Okay, let's talk about our patient today. Our patient today is a dentist. Young lady, a preeminent lecturer,
The dental hygienist
from Bulgaria,
Buffalo, New York,
Atlanta, Oklahoma, Vancouver, Canada, Boston, Kansas City, San Francisco, Montreal, Munich, Germany, London, and Santa Maria, California. And we're going to place 14 Lumineers,
8 Lumineers,
10 Lumineers,
6 Lumineers,
10, 2, 8, 8, 10, 10, 8, 10, 8 Lumineers today on our patient.
and now we're not treating teeth anymore. We're treating smiles.
Isn't that beautiful? So let's look at the transformation from where we started and where we are. Our patient today is an example of that.
I'd like to welcome you to our 2-day placement program where we do live placement of Lumineers. Our patient today is a dentist, and she's married to a dentist, and you'll see in a little bit that she has attractive teeth. Now, why is she sitting in the chair having veneers put on her teeth? Well, it happens to be that I haven't had to give a patient a shot for veneers in 20 years. Never given a patient a shot. Our limiting factor when we're contouring teeth, as some people might call preparation, is that if the patient feels any discomfort, they tell me, and that's where I stop. And then we take a look and see how attractive the smile can be without going any further. So that's why we are able to have this conservative philosophy. Lumineers, and as we'll go through it, all the things that you can do with them, are to supplement and expand your treatment capabilities for getting to patients who would like to look better. You're going to have some problems. Let me tell you what your 2 biggest problems are going to be. Your biggest problem is to recognize what you don't have to do compared to what you've been taught to do. Now, the principles will remain the same. However, getting to those principles is very simple. Instead of climbing over the mountain, you're going to fly over the mountain. Now, the next problem you're going to have is you're going to be so excited about this, is how are you going to communicate this to our patients that when you say dentist and you give them 6 or 7 words, there's one that usually comes up, and it's either uncomfortable or pain or money. Sometimes it's money. And those are the things that you have to keep in mind. Because just because you have the skill sets to do it doesn't mean somebody's going to sit in your chair. And I go to business meetings frequently, and I look around at people, dental meetings as well. Some of the leading dental lights are dentists, and I look at some of their smiles. And believe me, they know how to make them look better, but they chose not to. So this is what Lumineer means to you in expanding the new paradigm in the practice of dentistry. It's faster, it's easier, it's better, and get this, nobody looks as good as they could if they had Lumineers on. And when you see that in the course, you're looking at people who already start out. And look at Mrs. Hellwig, how she looks. Look at her teeth. Let's get a quick close-up. Nice and white. She has good occlusion. Now, if this patient was in your practice, I know you wouldn't cut those teeth down for veneers. Maybe you would. But she wouldn't have this done if you had your tooth structure had to be ground down, would you? No. See that? I want to show you some of the things just before we start that you can do with Lumineers. You can treat patients with diastemas. You can treat patients with misalignment. And you could even do severe, but we don't push the envelope on that. Many times you can either shorten orthodontic treatment time or you can avoid it by just taking care of the minor misalignments and rotated teeth, misshaped teeth, and you just shave off the corners on the enamel that are too prominent. And it's really nice with chips and cracks, you can take care of young people, old people, without having to cut the teeth down. Discoloration. And you can have patients with worn dentition. This goes way beyond just cosmetics. This is real problem solving. Now think about, for just a moment, all the patients in your practice that have clinically sound bridges and crowns that don't quite match. And you say it's not bad enough to change it, and the patient doesn't really want it done because they don't want to go through that again. All you have to do is take an impression, Make 8 or 10 Lumineers and go over it, whether it's porcelain or enamel, it doesn't matter. You can make their smiles look perfect. Believe me, when they hear that you can do that, and do it in that fashion, they'll want to have those old bridges made to look better. And the part I like about this the best is for these adolescent and pre-adolescent children. Now we used to say, well, they're too young for veneers. Well, they're too young for traditional veneers, but they're not too young for Lumineers. And that's the part. Look how your practice potential, treatment capabilities has expanded just with that list of things that I told you about. So I'd like to introduce my assistant, Lisa. You got to get in front of that some way. Look at Lisa. She's been with me since she was 17 for the last 10 years. 10 years. But Lisa knows before I know what I want. She hands it to me. I don't have to ask for it. So let's take a look at what she's done before we started. She has polished the patient's teeth with the porcelain laminate polishing paste. I like to use that instead of pumice. And the reason I like to use that is it removes the plaque from the tooth. If you put pumice on it, all it does is like old-fashioned toothpaste. It's just gross and it pushes it around. And then Lisa has, on these pieces of porcelain, I hate to call them veneers because dentists tend to think of a veneer as a restorative, especially a traditional veneer. So all these pieces of porcelain have been treated with 2 solutions, and they are the Porcelain Conditioner and the Serenade Prime. It's very important you put them on in that order and that you don't skip one of those. So Porcelain Conditioner is an organic acid, citric acid. So that's what we've done before we got started here. Now, by having everything ready, and you and your staff review the videotapes several times, and then they will know more about it than you will. And that's when you know you're ready. I want to show you just a couple of things here. Her husband took a wonderful impression with the Luminaire impression material, and that yellow going over that gray, this in the double impression technique, you really got some sharp margins there. And that's critical. We like to suggest that before you send your impression in, that you pour a model from it to make sure you're satisfied with what's there. So we're going to, the teeth have been polished, 2 solutions on the porcelain veneers, and she has a very good dentist that she goes to. A little endo on those crowns. Have you ever seen endo on a crown? And sometimes we have to take away that much tooth structure, but you'll never see endo on a Lumineer case because we never take off that sensitive tooth structure. Isn't that nice? A couple things are important. I'm wearing magnification. That's critical. This is a Lumineer magnifying system, but the key point is it's light, it's easy to put on your head. You got to spend a little time getting it adjusted and getting an optical specialist to get your prescription put in the frames, and it should be set. All the instructions are in there. But I'm working with 4-power magnification. If I didn't have that, I wouldn't be able to go through this process nearly as well. And it enables me to create seamless margins and feather edges when finishing chairside. You'll see that. And another thing you'll see when we place these is the Sapphire Light. It takes less than a minute to place 8 Lumineers. It gets maximum output for cure in deep restorations or through crowns and veneers. It takes about 3 to 5 seconds per tooth. Actually, I use 5 seconds. And you can also use it as a whitening light. No matter what bleaching system you're using, the Sapphire Light will, in fact, work and make any chairside bleaching system work better. So let's get started now. We're going to put a little bit of etch and seal on each tooth. And I like to just place a little dab, and the reason I like etch and seal is because it's phosphoric acid with aluminum oxalate in it. Now we got a little bit of a challenge over here. Got a porcelain crown. And then I'll take the brush and I'll push it around. Now the nice thing about the aluminum oxalate is when you take the etch and seal and put it on, see it doesn't run all over their mouth, and you can just put a little bit on, push it around. If you're putting it on dentin, the aluminum oxalate will seal the tubules. Okay, well, we haven't etched that or used the micro etcher on there. I put the Porcelain for etching the porcelain. And what I'm doing now, and I learned this from the young David Ouellette, Dr. Ouellette, is I'm putting a little bit of paint on dental dam on the interproximal. And by putting that resin in there, and it's blue, it will prevent the Ultrabond from getting embedded so much. I thought this is a really clever little thing. Just takes an extra minute, paint on dental dam. It's the same thing we use when we're isolating teeth for chairside bleaching. Now close your eyes. The best way to protect your eyes is to close them. I'm going to give it 3-second bursts. Here we go. Close. 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 Now take an Explorer and check these. And we just want it to be set. We don't want it to be rock hard. All right, so see that? So we're now putting the surface treatment on the porcelain. Usually we micro etch that first. Okay. And then we're going to put the porcelain Serenade Prime on. And we'll just let that sit there. And what the porcelain conditioner does is it activates the silane. Now we're putting the Tenure AB on. And it's just a simple solution. And the reason I like Tenure AB is it's not sensitive to the light. The Tenure AB is almost instant. It doesn't have to set up. You don't have to put the light on it. It works with all the composites. Now what we're going to do, I want to show you something here. Which tooth is this? This is the patient's left central. So we're going to put this on. And I want to show you what happens when you don't put these on with tri-in paste. Or what shade is this? Now we're using the Ultrabond tri-in paste next to it. And this has got shade B1 in it. And I think we're using B0 on her regular teeth. But you see, I don't know if you can tell, but this is not the same shade as this is. Let's do the left lateral, so we'll compare that to the right, to the left central. And what happens is that when you have the tri-in paste, if you look here carefully, those margins are open on the patient's left central. They're not open on the patient's right central. That's because they're filled with the Ultrabond tri-in paste. Now, the only difference between the Ultrabond tri-in paste and Ultrabond is the tri-in paste is not activated. So you'll get an exact, and we're going to tri-in paste with the white. And this is the left lateral. Okay. So now we see the left lateral and it oozes out. Now, I rarely put all the teeth in and let the patient choose which one they like because Lumineers never look as good as they will look after they're bonded. Now, I'll take a brush and wipe some of this off. But the reason why, if you try a Lumineer on or any etched veneer on without the tri-in paste in there, you always get a different shade. And we don't have any Tenure S on here yet. So remember, we did two solutions, etching solutions and Tenure AB. Now we're going to look at the shade. This is a shade with A1. This is without anything. Now, why is this lighter? Well, probably some of you know I'm an optometrist. And there's a thing called the index of refraction, a thing called a critical angle. When light exceeds the critical angle, it never goes for any further. So when you have air between the luminaire and the tooth, then the reflection coming back is of the etched surface of the luminaire. Whereas when you have the tri-in paste in there, it's a continuous mode and you don't exceed the index of refraction at critical angle. And so then you're going to get a very exact look at what this is going to look like after they're placed. Now this is Tenure S. We're using Tenure S to remove the tri-end paste. Now Tenure S will make the inactive Ultrabond Plus, the tri-end paste, set. So we don't want to spend a lot of time once we put that on. Notice we didn't put it on before we did the tri-end because it sometimes screws things up. And then we'll put the Tenure S on the other teeth as well. Okay, now we've done 10 teeth. And if you want to work hard, you want to do 3 teeth, you want to do 1 tooth, you want to try to match something. So when you do 10 teeth, they're going to look good because they're all going to be the same shade and everything's going to work out. Which tooth?
Left central.
Left central. And she always calls out the tooth by name, not by number. And that way I know exactly what tooth she's talking about. Now when you put these on, you have to be real careful because sometimes you can't force them into place. And this is?
Right central.
Right central, okay. This one here, now what you want to make sure when you put these on is they're gently into place. Don't force them. You want to be like a bricklayer and tap them into place. Now what I want to do is get some of these fixed. Give me the cuspid. I put the Tenure S on, and that helps. And so I put them on. I'm not using anything in between the teeth. And what I'm going to do is right now I'm going to use the 2mm tip for 1 second. Give me that right cuspid, left cuspid. And because I'm concerned about contamination and getting these into place. And I'm going to give a 1 second burst with the 2mm tip. So close your eyes. And then I want to watch the oozing out. Place it and hold it. Close your eyes. And then very little pressure. But I have positive seat. Close your eyes. And close your eyes. Now what I've done is spot bonded these front 4. I can relax there, and now I'm going to come over here to the left side because we have Tenure S protecting that. You know, you can't contaminate it. That's why I put the Tenure S on. It prevents contamination. And I'm going to put the left first bicuspid on. I'm going to take the light. And again, the 2mm tip. This 2mm tip for 1 second is really critical. Close your eyes. And I push this on and I see a little Ultrabond ooze out, so I know I got my margins covered. And I see a little bit ooze out. Close your eyes. And with everybody's eyes closed, including my own, now we'll come over here to the right side. The Tenure S is protecting the surface treated with Etch and Seal and Ultrabond, and Etch and Seal and Tenure AB. And we wipe most of this off. And now we'll take the light, we'll spot cure, 2mm for 1 second. And I want to make, close your eyes. You want to make sure you've got a good finger rest when you put this on so it doesn't slip. Close your eyes. And close your eyes. And there you can see the excess Ultrabond everywhere. But because I spot cured it, I don't like to do the cure where I wave it over all the teeth. And I wipe most of the excess off. So you just go ahead and finish them all, and then on the subsequent appointment, take it off. But to get these off, we use the Luminaire finishing kit. We just take an ultrafine diamond and just grind away everything that we put on there with magnification, with 4 power. That's why 4 power is so critical. If you're not working with 4 power, you're really handicapping yourself. Let's show everybody what it looks like now just before we do the curing. So we got most of it off. What I'm looking for is to make sure that we have a good sealed margin between the porcelain and the tooth before we set all of this. So now we're taking the 9mm tip, and we'll just turn it over this way just a bit. 1 tooth at a time for 5 seconds. Close your eyes. Just take the excess here and remove most of it.
Upper left second.
Right. Now I'll do the upper left first. Close your eyes.
We are fortunate enough to have 2 lights. Go at it with 2 lights.
If you have 2 lights, you can go on both sides, and you can have your staff member do it one side, and you can do another. Well, I guess it's your choice how critical the color match is. But if you're doing an onlay, you're not going to, usually if it's porcelain, you're going to have, it's going to have some thickness to it. You see, these work because the teeth are protecting the luminaire. And that's a thing to keep in mind. Close your eyes. Close your eyes. Now I'm going to remove the paint on dental dam, and I'll let you watch me do that. And we'll see what we've got. See how we start lifting that off? Can you see that? It's got a little more set here. But look how those interproximal embrasures now are open. That's it. All right, now let's see. I want to just check on the lingual side, and maybe you'll put the light on the lingual layer on that cuspid. I'm not sure it covered all of it, but I think it did. We'll just come back and set what might not be set. Here, I'll give it a little broader. Close your eyes. Close your eyes. Close your eyes. So in less than 2 minutes, we've got it all done. All we have to do is adjust the contours and these incisal edges. And I don't know if you noticed when we did the try-in, but at first, these teeth looked exceptionally long. And that's why you don't want them to look at it. You get it all in, get it done. And then we're going to do contouring. So from here on in, what have we done? If you think about what they taught us in school, cavity preparation, fill the cavity, check the occlusion, adjust the aesthetics, and then look at the patient overall, right? Or finishing out, the finishing in there after that. So that's just what we're doing here. Now, the only thing we didn't do is we didn't do cavity preparation, but we did the equivalent of cavity preparation. Cavity preparation is designed to hold the restoration without weakening the tooth. Now, we didn't weaken the tooth at all, did we? We didn't take anything away. Now the tooth is stronger. Plus, her teeth were sensitive. She's looking forward to getting these Lumineers because they seal all the tubules. It's fantastic, okay? So approximately 17 or 18 minutes later, we bonded 10 Lumineers in place. So now we're going to take a half hour finishing them. Let's talk about finishing. What do you want to accomplish on this finishing visit? You want to get everything so it looks good. You want to be 80 to 90% finished. Don't keep the patient in the chair more than an hour to an hour and a half at the most. Then when they get out of the chair, they're happy, they're not too tired yet. And what you do is you have them back in a week, Generally, the Ultrabond you didn't get off fell off. You tell patients it's not your tooth, it's the bonding material. You get to take a look at the interproximals that maybe you didn't open some. Most of the time, 3 out of 4 of them will open on their own just by normal occlusion. And you get to check the occlusion, and I always do some more contouring and modifying, and you'll do these when you go home. And all you have to do is have that finishing kit to put the polish back on when you do it on the labial. So we're going to do enough today to get these so they really do look nice, don't they? Huh? A little reinforcement from the dentist never helps, does it? Never hurts. Yeah. Okay, so let's take a look at the finishing kit that we're going to start using. Now, everything you need is in there. And you have that burr block around. Yeah, this is the burr block. Everything's in there except this 12 fluted burr, and you probably have a lot of those around. And I'm going to use a 12 fluted burr. The 30 fluted burr is in the finishing kit. All right, now what we're going to do is just come in here and start defining the interproximals. If you look at these interproximals, they're not very well defined. And so your Lumineers will never look as good as they're going to look on your second visit. They'll look much better on the first and really phenomenal on the second visit. So now I'm just going to turn your head over here. And I use this fluted burr to remove the Ultrabond restorative. Remember, Ultrabond is an ADA Type 2 restorative. So it restores the tooth. That's why you don't have to do composites first and then take your impression. And the burr will not cut the porcelain very much, if at all. So what that acts as a guide for me to just be removing the Ultrabond. And we're opening these interproximal embrasures. Now somebody's going to start thinking my hygienist could do some of this. Because if you're not touching tooth structure and you're not doing cavity preparation, there's nothing irreversible being done. And then after we get this excess off, we come in with the ultrafine diamond. Always use ultrafine diamonds. And then when you take the glaze off at the gingival and the interproximal, remember it's like a stealth airplane. Stealth airplanes work because nothing gets reflected back to the source. So if you're working on the interproximals and the gingivals, that doesn't get reflected back to you. It's just the labials. Now we're on the 10th veneer, taking off the extra. Remember, that one's porcelain on porcelain. Now we're going to take the Sure 349. I'm going to show you the Sure 349. That's in the finishing kit. And we're going to go over here. It looks like a scaler, but it's not. It's really an orthodontic band seating instrument. You will never scratch glazed porcelain with the Sure 349. Now look how this stuff starts popping off. Remember? Because when I was using the water spray, it was just enough to start loosening this. Okay? And suddenly things begin to take shape. We've got a little contouring to do on the incisals of these centrals, not much. I'm going to open those interproximal embrasures. Okay. So now we've pretty much cleaned things off the front a little bit. I never showed you the football-shaped diamond. This is the football-shaped diamond. And it's an ultrafine diamond. The only time I use burrs is the 30 fluted and the 12 fluted. I'll use a burr sometime, but an ultrafine diamond for contouring the teeth. But other than that, I like to limit my contact between grinding tools to be diamonds, ultrafine diamonds. Now we're going to go on the occlusal surface and blend the Ultrabond and the porcelain and the tooth all together. So it'll be one solid mass. And I'm doing that with direct vision. But as I look at the tooth, I'm looking at something that looks like it's only 3 inches from my eyes. When in reality, look how far away I am, about 14 inches from the tooth. That's why magnification is so critical. Like you said, I made it look easy. And it's only because I have the materials and the equipment to enable me to make it easy. Cut this way. That's important. Somebody asked me, why don't I not use water? Well, if you don't use water and you've got it on the porcelain, there's a good chance you'll get too much heat and cause fracturing. They never grind optical lenses without having them bathed in water. Now you can see what we've got on the lingual side. And you can see these embrasures are filled in, and over here we pretty much got it open. I'm going to come back now with the needle-shaped diamond and open these embrasures. And it flakes off the tooth. Now there's a little tip about finishing veneers when you put them on porcelain. It takes about 24 hours to get a maximum bond between porcelain to porcelain. Now what I'm doing is taking this needle nose diamond along the gingival margin, and I'm getting it to have a finish that gets rid of the shoulder that I put on there when I put the Lumineer on. And so you can simply check it. And if you don't get them all completely blended on this visit, you can do more in the next visit. And that's usually what I do, is get most of it. And I'm opening these embrasures because, remember, these contacts are fused. And with 4-power magnification, you can see the difference between porcelain, ultrabond, and tooth structure. And you know, another little trick that I like to do is I like to get down and blend the porcelain to the tooth so that there's a transition, not a sharp line, not like a shoulder. And it gives it a very natural look.
The angle seems to be 30 to 45 degrees.
Yeah, the angle I use is 30 to 45 degrees. Remember, you don't have to do it all today. And the other thing is, I look up here, I say to myself, now that lateral looks a little more square than I want it to look. So I can take and blend that. And I don't have to do it on the placement visit. And the other thing I like to do is I like to take the distals of the laterals and round them a little bit. That gives definition. Now we just go over here and do a little bit more. And you notice we're taking more time in the finishing than we did in the placement. So sometimes people say, well, you know, I don't like this technique. It takes too long to finish. Well, I can tell you one thing. It takes a lot less time to finish than it does to prep, retract tissue, get impressions, and make temporaries. And I'm just talking about time. I'm not talking about discomfort. Now, when I get on the porcelain, all I want to do is remove most of the excess. I'm not going to try to open that contact. And I tell patients to be very careful with it for the first 24 hours. And then we do the final finishing on that visit, usually a week later. Now, what I'm looking for in here is ultrabond that may be on the adjacent teeth. Close. And grind around just a little bit. Close. See, don't they look nice? Huh? Yeah, open. Now we'll take a look at the centric prematurities and eccentric. So if I can have the Sure 349, we'll look over here. And can you see the blending of the porcelain to the tooth? Now this is natural tooth structure. This is good. This is good. This is good. Uh-oh. Look what I got here. See, I've got a little heavy spot right here. And if you let them go, that one's asking to be cracked off. So we got to do something there. When you go through your excursions. But this really looks nice. We got, usually what happens is if you got ultrabond, there's a little ultrabond on here on this. So we're going to get rid of that spot, and we're going to look on the lower. Close just a little bit. Close. Okay. What we're looking at here is composite that he direct bonded to maintain the space before she got her Lumineers placed. So it showed up just perfectly. And we'll take this out right here. Now let's have the mirror again, and we'll all check the occlusion. I'm feeling good about this because what we're really looking at is a lot of occlusion in centric. See that on the bicuspids? And a lot of the marks are on the natural teeth. That's a pretty good sign. And where's that ultrafine diamond? I go on the lingual and I remove the excess on the interproximal. The secret to opening these is to remove as much of the ultrabond interproximally as you can. So I want these embrasures to be, and we're not going to fool around with the embrasure between the first and second bicuspid on the right. Now we'll take the seri saw. This was developed by Dr. Harvey Putter. Now just notice how I go through that interproximal. Did you see that? Now notice when I'm sawing, I just start rocking. Because the amalgam wedge, if you haven't used this before, and you start putting a lot of pressure on, sometimes when you break through, you slip and cut the gingiva. And it's usually not a big event, except in your mind, because you see a lot of blood going. The patients don't feel it because it happened really quick. And that's why I don't use it, because so far I can generally do it without ever cutting any gingiva. Now see how I'm rocking it here? I'm not sawing. You see, this is all we're doing is opening the contacts, and we don't open them all, just the easy ones. And this one here, I guess I'll go for it. Yeah, that was pretty easy. So we haven't found one yet that we couldn't open on this visit. And she's probably thinking, well, he's using a little pressure here. Another thing I'm looking at is I want to roll that cuspid in on the incisal 2/3. Don't you think that would look nice if it didn't flare out? And we'll just start doing that again and start rocking. This rocking thing is really critical because you keep a lot of finger control. And you're not trying to get it so you can run through floss through there. You do that on the second visit. Okay, now here is the seri sander. Safe-sided. A lot of orthodontists use this, and we put this on the seri saw handle, and it gives you a lot of control. Okay, now we're going to wash things off here a little bit. Let everybody take a look. Now, if you take a look at these, remember how they would have looked? See this? Remember how they would have looked if we looked at them before we finished them? Those embrasures wouldn't be open. They wouldn't look like natural teeth. And now you got it, right? Isn't that great? Huh? I'd rather do less on this visit than too much and then have the patient back. Now, on the second visit, they're looking at it. They tell us about their friends. They're nice and relaxed. You sit in the chair, you visit, do a little messing around and final touch-ups here and there. And it's been a piece of cake. And if you go with traditional veneers, patients are petrified. I mean, we have dental assistants call us and say, we'd like to have veneers, but we don't want what our dentist does because they want to keep their tooth structure. My most frequent patients are dentists, dentist family members, and dental assistants that work for dentists that do tradition. Okay, and so I guess that's it. Anyhow, it's been really great being with you, and we invite you to come up. It's a lot of fun. Do you have any questions? Good luck. Okay. See you guys.